Okay, this will be our second video on surgical clerkship, and today we'll be talking on how to take investigations in surgical clerkship. All right, how to take investigations in surgical clerkship. So basically, you are taking the history of a patient that came to the hospital. You have done the physical examination. Then, how can you proceed with your investigation as a surgeon? All right, so the question in full, discuss taking investigations in surgical clerking or clerkship or clerking though. All right, so this is just an image showing the importance of this knowledge that we are teaching you guys as future surgeons, for you to recognize, okay, the importance of having a team, for you to inhabit the role of being a surgeon, for you to understand surgical careers and all that. Okay, so in this lecture, we'll be talking about how to take investigation. So remember that accurate preoperative assessment is vital to prevent complications and optimize patient outcomes and ensure efficient user resources. Okay, so preoperative assessment is basically like, okay, you study the patient even before the surgery. Okay, this entails that, okay, when you study the patient, maybe you get to know that maybe the surgery that you were having in mind is not even a good surgery for a patient. Okay, so I remember the issue of Michael Jackson. His doctor in 2009 gave him anesthesia, okay, or a drug that will help him relax or sleep while they attend to him in a medical process, okay, and that was how Michael Jackson died. Okay, and I've learned that the doctor have lost his licenses. Okay, so because the doctor did not study Michael Jackson before giving him that drug, okay, if he did, maybe he would have used another alternative. Okay, so it's always good for you to take your investigations before performing a surgery, so that you know that this type of patient, this type of process is not good, this type of process is not good, and all that. Okay, so in taking investigations, you can use imaging. All right, you can use ultrasound, like maybe in pregnant women. Maybe you want to check how the baby is doing before you operate the mother and all that. Okay, they are about radiograph. I think that's the same thing as X-ray. Maybe you want to perform a surgery to correct maybe a rib fracture. You take an X-ray so that at least you know which rib is even fractured. Okay, then CT scan too is the same thing. It gives you the picture of that inner body. Then magnetic resonance imaging, so that's a MRI. It's still the same thing, all right? They basically give you an idea of how that part of the body that you want to operate on looks like on the inside. Okay, these are all pre-operative investigations. All right. Then another way you can investigate before performing surgery is pathological investigations. All right. So you actually investigate this person if this person is having an underlying medical condition. Okay. Is he asthmatic? Does he have high blood pressure and all that? And in using all in pathological investigations, maybe you use body fluids, you take them to the lab, you do some testings and all that. Okay, these testings could be hematology. Hematology, this one has to do with blood. Microbiology, those are checking all those microorganisms and all that. Histology, histological stains and all those stuff. Then chemical pathology, all right? They access to see if you have any pathological condition, all right, or any underlying illnesses, all right? So these are pathological investigations. And this is like the second type of way we can use to investigate. The first one was imaging, use all those ultrasound, radiograph, CT scan, MRI, and the next one is pathological investigation. All right. So guys, that's it about taking investigations in surgical clerking. I hope you guys understood the lecture. See you guys in the next one. Bye for now.